This is not a question for you because I know your answer, you have a young child. But for everyone else, how have you been sleeping lately? If you've been feeling overly tired, you may be one of the millions of Americans who have obstructive sleep apnea, but you don't even realize you have it. Dr. Anna Smith from Dentistry with TLC in Godfrey, Illinois is here to show us how oral appliance therapy can bring you some relief. And one of her patients, Joe Shoppett, has found great success with this. Welcome to both of you. Nice to have you here.
Hi, Matt. Thank you.
Nice to see you again, Dr. Smith. And Joe, we'll talk to you, one of the success stories here in just a moment. But first, a little bit about sleep apnea and why it is difficult to diagnose.
Sure. One of the reasons it's difficult to diagnose is just getting people to be aware that they may have this problem, because it happens when you're asleep, and so you don't know that it's happening. It usually takes someone telling you, hey, I heard you gasp for air when you were asleep, or you snore really loud. Usually those are some of the warning signs. So at first it's just hard to get a person to understand they may have a problem.
Sure.
But once a patient is tested, usually you have a sleep study to diagnose if you have sleep apnea. Then what typically happens is you're given one of these machines to try to sleep with a mask on your face while it's forcing air down your nose and your throat. And lots of people just can't tolerate it. They just can't sleep with all that happening. And sometimes you're not always told that there are alternatives other than just having surgery. Many times people don't know that you could just wear a retainer at night like this.
Well, and now this is, see, once let's say you are diagnosed, or someone you know is diagnosed
Sure.
with sleep apnea, first thing that pops into my brain is not, I'm going to go to the dentist and have this checked out. But maybe we should, because of that little contraption right there. You call it an OAT.
It is. It stands for OAT, stands for Oral Appliance Therapy. It actually has been in medical journals since about 2006 that this is the best way for mild and moderate people with mild and moderate sleep apnea to treat their disorder rather than using this mask. But it's not well known yet.
Right. But it's something you can do through TLC Dentistry, through the
Yes.
dentist. Joe, that's where you come in. You had been going to Dr. Smith for some time, and you had been using one of these kind of Darth Vader devices where you were playing dress up every night, putting this mask on your face. What was that? You tried this for about a year, you said, yeah?
Yes, Matt. I used this religiously for less than a year, and I went to bed with it every night and filled this little contraption up with water and then turned it on and then put this mask on and then try to kiss my wife goodnight.
Yeah,
that's
good
kind
luck.
of funny, yeah, with that mask. So it wasn't very nice. So I tried and it just through in the middle of the night I'd have to take it off. It was just suffocating me. It was just it just wasn't natural feel. So I was searching around everywhere trying to look and see what is out there. And lo and behold, as I was getting my work on my teeth and everything, she had some advertisement on about these items here. I said, well, let's try that. There's got to be something else out there, and I'll be darned if this little mouthpiece just worked wonders. And at first it took some adjusting time, but about a month later, I was sleeping through the night, and my wife said, honey, am I snoring? And she said, no, we're back to normal life again.
And you feel better rested in the morning?
Rested. In the morning I wake up, I snap right up out of bed, and I'm more alert now than ever before. So thank goodness. It's just amazing to go from this expensive machine to this simple little mouthpiece.
Put it in your pocket.
Yeah, and it fits so comfortably at night. It's just a wonderful device, and thank goodness for that.
That's great. And Doctor, that adjustment period he talked about is
Yes.
probably pretty typical, right? You got to make sure the fit is right and that everything's hunky-dory.
Absolutely. This is not something you want to just buy on the internet and put in your mouth and hope it works. This is something you want to see a professional for, to be fitted and adjusted for.
Gotcha. Just so happens we know one. Right over here. Dentistry with TLC, also the home of fast braces that we've talked about on the show before. You can check out a full interview about fast braces and learn more about Dr. Smith's full range of services at dentistrywithtlc.com. And if you want to visit her in person, her office is located just 30 minutes from downtown St. Louis in Godfrey, Illinois. Call 618-466-0733 for an appointment.